Hello everybody, my name is Amir Faraji and I will be discussing about the recurrent laryngeal nerve. So a little bit of overview about what's going to be discussed during this presentation. I'm going to talk about the recurrent laryngeal nerve itself and how it supplies the intrinsic muscles of the larynx, a common developmental disorder associated with the current laryngeal nerve, the left and right recurrent laryngeal nerves, and injuries and other pathogens that affect the nerves. The recurrent laryngeal nerve is one of three nerve supplies that innervate the larynx, specifically innervating all the intrinsic muscles of the voice box, with exception of the cricothyroid muscles. As the vagus nerve descends along the trachea, at vertebrae level T1 to T2, the recurrent laryngeal nerve begins to branch away from the right and left vagus nerves. And upon these divisions, they will then begin to ascend along the tracheo-esophageal groove and then finally reaching their target organ, the larynx. Now, the larynx, also known as the voice box, is responsible for breathing, sound production, and protection of the trachea. Now, in addition with the recurrent laryngeal nerve, the other nerves that innervate the larynx are the superior laryngeal nerve and the sympathetic fibers. The intrinsic muscles of the larynx are responsible for sound production and the movement of the laryngeal cartilages and folds. Of these, you have the vocalis, which shortens the vocal cords, the thyroid arytenoids that relax the vocal cords, and you also have common adductors such as the transverse and oblique arytenoids and lateral cricoarytenoids. And the only abductor of the entire intrinsic muscles to the larynx is the posterior cricoarytenoids. Now, in this image, you will notice that the cricoarytenoid muscle is the most anterior muscle group of the intrinsic muscles. Posterior lateral to it, you have the thyroarytenoid muscles. Now, in the next image as well, you can also see that you have transverse and oblique arytenoid muscles. To the right of that, you can also notice the vocalis muscles. And inferior to the vocalis, you have the lateral cricoarytenoid muscle. To the left of that, you have the posterior cricoarytenoid muscle. Now, a common developmental disorder associated with the recurrent laryngeal nerve is the non-recurrent inferior laryngeal nerve. And this developmental disorder has an occurrence rate of about less than 1% in patients. This disorder is a consequence of anatomic distortion by masses, inflammation, or most commonly caused by vascular anomaly. The laryngeal nerve can go in one of two directions, either superior to the pole vessels, as shown in figure A, or inferior to the thyroid arteries, as shown in figure B. Any patient that is present with this disorder has an increased risk of having an injury during any type of operation that occurs in the future. So the left recurrent laryngeal nerve is the longest of the two, measuring at about 12 centimeters long. In its course, the larynx is divided into 5 zones. So at zone 1, which is the origin of the carotid artery, at zone 2, that's when it begins to split from the vagus nerve, going over the aortic arch, and then travels under the aortic arch, indicated by zone 3, which then it will ascend along the tracheoesophageal groove at zone 4, and then at zone 5 is when it reaches the intrinsic muscles of the larynx. Now, the right side is not as complicated as the left. It only measures to 6 centimeters, so it's half the length of the left side. And the right side is actually the motor nerve. It branches from the vagus nerve at the level of the right subclavian artery. As it branches from there, it'll travel underneath that artery and then going posterior to the bifurcation of the brachiocephalic trunk, and then descend along the tracheoesophageal groove, finally reaching the larynx. As you can see in this image, you can see the right recurrent laryngeal nerve branching just at the right subclavian nerve, where the brachiocephalic trunk is located. you could see that red line indicating right recurrent laryngeal nerve is going posterior to that site and then traveling along the tracheoesophageal groove and then finally reaching the larynx. Now, this is not a common pathogen that damages the recurrent laryngeal nerve. This is the most common cause of vocal cord paralysis. That is just surgery. Certain surgeries such as parathyroid and thyroid are seen to be the most associated with damages to the recurrent laryngeal nerve because the surgeons have to access the C7 to T2 region. Most commonly, they damage the left side because the left side is the longest of both the right and left recurrent laryngeal nerve, and its course to the larynx is also the most complicated and is the most easily damaged. Now, an example of pathogens that affect the recurrent laryngeal nerve is the Epstein-Barr virus. Now, this virus is a member of the human herpes family, and a common disorder associated with Epstein-Barr virus is mononucleosis, or the kissing disease. Now, serological testing is normally conducted to diagnose somebody with Epstein-Barr virus. Physicians will notice elevated antibody levels of IgG and IgM. If left untreated, can cause unilateral recurrent laryngeal nerve paralysis, specifically on the left side. At this point, the only treatment that could actually work is speech therapy. Another disease that's also associated with unilateral paralysis is Lyme disease. Now, Lyme disease is caused by vector transmission of Borrelia burgdorferi, which can cause neuroborreliosis. Neuroborreliosis most commonly causes right recurrent laryngeal nerve paralysis, and serological testing shows elevated antibodies of IgM. Luckily, this one is easily treatable by just a normal dosage of antibiotics. Now, Epstein-Barr virus and Lyme disease are common causes, but I wanted to discuss about this case about George London because it's a very unusual case. Now, George London was an opera singer in the 1960s. As an opera singer, you can only imagine how many problems with his voice this man had to endure. He was a mess because of how much he had to sing. But he was diagnosed with right vocal cord palsy. So George London, while he was on tour, he was injected with a dirty needle for vitamin B. When he was injected with this needle, he acquired hepatitis. Hepatitis alone is not associated with unilateral vocal cord palsy. But however, hepatitis infection is found to be associated with various systemic diseases such as vagal neuropathy and laryngeal dysfunction. In George London's case, hepatitis caused vagal neuritis, which is how he was diagnosed with right vocal cord palsy. However, his left side was not affected at first. He continued performing until 1965, where his singing career was then finished because he was diagnosed with post-viral vagal neuropathy, which then ultimately ended his singing career. So George London's case was just a little bit, I thought it to be interesting because it was a little bit unusual because throughout the reading he had surgeries to fix this. They then finally realized that hepatitis was one of the causes towards this. I want to finish off this presentation with Proverbs chapter 17 verse 27 and 28 because I felt that these were the most applicable to the recurrent laryngeal nerve because it is the voice box. And what it taught me is that sometimes it's not always good to express your opinion. And then the ones that can hold back and not have to express themselves every time are the ones that are actually the most knowledgeable and the most wise of any person in their group. So I want to read these to you. It's verse 27 goes, "The one who has knowledge uses words with restraint, and whoever has understanding is even-tempered." Followed with, "Even fools are thought wise if they keep silent, and discerning if they hold their tongues." So it really spoke to me in a different way because I feel that it's very important to express your opinion, but at the same time understand that you're not always right, and maybe having somebody else speak is the right route rather than you having to always speak. I hope you enjoyed this presentation. If you look on my next slide, it is the list of my references, and have a great day.